Apathy and motivation after ABI. Introduction. What is ABI? It is a brain injury that happens after birth. The cause of it is by trauma, stroke, infection, or lack of oxygen. It can affect thinking, emotions, behavior, and daily life. Apathy in ABI. A common and serious neuropsychiatric syndrome. Loss of motivation, interest, and emotional connection can lead to social withdrawal and difficulty in recovery. Why it matters. Apathy makes rehabilitation and daily life harder. Understanding and treating apathy can improve recovery and quality of life. What is empathy? Empathy is a neuropsychiatric syndrome, affects both brain function and behavior. Persistent loss of motivation and interest. Long-term difficulty in starting or engaging in activities. More than just tiredness or boredom. It leads to emotional interference and withdrawal from daily life. Apathy versus depression. Apathy, emotional flatness, lack of motivation, no distress. For the depression, it includes sadness, guilt, emotional suffering.
Next, key symptoms of apathy. Some key symptoms of apathy that we can look for. These include 1. A lack of goal-directed behavior, struggling to solve complete tasks. 2. Not reduced emotional expression, not showing much reaction to positive or negative events. Diminished interest in social and cognitive activities. Example, driving hobbies and learning. A third sign is losing interest in daily activities, so talking less, interacting less with family and friends, or setting goals, trouble setting goals, or making plans for the future. Because of these symptoms, a person with apathy may stop doing things that they used to love, stop keeping in touch with friends, or struggle to keep or follow treatment plans. Now, diagnosing apathy is very important because it helps doctors choose the right treatment. Apathy is mistaken for depression when treatment may be given. Therefore, understanding the difference allows better support rehabilitation strategies to help individuals gain motion and improve the quality of life. So how apathy impacts recovery. Apathy impacts motivation and effort. Without direct support, apathy can continue for years, making recovery even more difficult. It also affects relationships, as family members and caregivers may struggle to connect with a person. Apathy doesn't just affect therapy, it also impacts a person's ability to live independently. Individuals may struggle with self-care, such as eating regularly or completing household tasks. If not treated, apathy can make a person more dependent on caregivers, daily tasks, exhausting family members in the process. Therefore, early detection and the right interventions can help individuals improve their participation in therapy, rebuild social connections, and regain more control over their daily lives.
How common is apathy in ABI? Studies show that apathy is reported in 20 to 70% of TBI patients. The exact percentage depends on different factors such as how severe the brain injury is, which areas of the brain were affected, how and when apathy is measured, whether through a doctor's assessment or patient self-report. In stroke patients, up to 50% experience apathy at some point in the recovery. This means that for many people with ABI, apathy is a major challenge that can make daily life and rehabilitation much harder. Apathy is not just a minor issue, it is often one of the most common and long-lasting symptoms of moderate to severe brain injuries. It can slow down recovery by making people less likely to engage in therapy or treatment. It affects social relationships and everyday activities. It increases dependence on caregivers because the person may not feel motivated to take care of themselves. So now that we know how common apathy is in brain injury patients, let's look at what happens in the brain that causes apathy to develop. Apathy is linked to three key brain areas. Prefrontal cortex. This area helps with decision making, planning, and motivation. When damaged, a person may struggle to start tasks, stay interested, or follow through with goals. Basal ganglia plays a key role in movement and motivation. Damage here can reduce drive, making even simple tasks like eating or talking difficult. Anterior cingulate cortex, important for attention and emotions. Damage can lead to difficulty staying engaged and showing emotional reactions. The brain also relies on chemicals to send signals. Dopamine, the reward chemical that drives motivation. Low levels can lead to loss of interest and excitement. Acetylcholine helps with focus and thinking. A deficiency can cause problems with attention and engagement. Motivation is not just a personal choice, it is deeply connected to brain functions. When these areas and chemicals are affected, staying motivated becomes much harder.
Apathy is diagnosed through clinical assessments, self-reports, and caregiver observations. This means that doctors look at a patient's behavior, ask the person about their experiences, and sometimes rely on family members or caregivers to describe changes in motivation and daily activities. There are several tools that healthcare professionals use to measure apathy, and these can include the Apathy Evaluation Scale, which helps assess a person's motivation and engagement in daily life. There's the Neuropsychiatric Inventory. This tool measures emotional and behavioral symptoms of apathy. There's the Frontal Systems Behavioral Scale, and it's used to evaluate problems related to the frontal lobe, which is often affected in brain injuries. And there's also the dimensional apathy scale. This helps identify different types of apathy since it can appear in different ways in different people. Now that we understand how apathy is diagnosed, next we will explore several effective treatments and interventions that can help people regain motivation and improve their general quality of life. The best approach often involves a combination of medication, therapy, environmental changes, and physical activities. Doctors may use medication like dopaminergic agents to increase dopamine levels, which helps with motivation and goal-directed behaviors. Cholinergic enhancers to support cognitive function and attention may also be used, and antidepressants are sometimes used, but those need to be prescribed much more carefully as they can actually worsen apathy in some cases. Behavioral strategies and psychological therapies can also be effective in treating apathy. Goal-oriented tasks uses structured activities with rewards to encourage participation. Cognitive behavioral therapy helps individuals identify and change negative thought patterns that may be holding them back. And motivational interviewing is a method that helps individuals set and achieve meaningful goals by increasing their self-motivation. Environmental modification can also be used to make small changes in the environment to help increase motivation. Having a structured schedule, like making use of alarms, visual cues, and having a task list, can also help individuals stay on task. It's also worth having and integrating more social interactions. So, encouraging conversation and social activities can help keep the brain engaged and motivated. And with regards to physical and occupational therapy, exercise and engaging in meaningful activities can actually significantly improve apathy because having regular physical activity helps stimulate the brain and boosts your overall well being. Occupational therapy can help individuals find activities that match their interests and abilities, making it easier for them to stay engaged. By using structured reinforcement strategies and gradual behavior shaping, ABA can help individuals develop a sense of accomplishment and build long term participation in activities. There are three main ABA techniques that can be used to help manage apathy. The first is positive reinforcement. This means rewarding goal completion to encourage motivation. For example, if a person completes a small task, they receive a preferred reward or positive feedback, making them more likely to repeat the behavior. The second is task analysis. This technique breaks down a task into smaller, manageable steps instead of asking someone to complete a full activity at once. They are guided step by step, making it feel less overwhelming and much more manageable and achievable. Lastly, there's shaping. This method gradually increases effort and participation over time. If someone is struggling with engagement, they start with very small, easy steps. As they become more comfortable, expectations slowly increase, leading to long-term progress. Why AB works in general is because it helps people feel successful with small accomplishments. It keeps them engaged in activities consistently, and it provides clear goals and encouragement to maintain participation over time.
What does research say about treating apathy? Studies highlight three key strategies. First, multimodal treatment, which involves combining medication with behavioral therapy to achieve better outcomes. Second, personalized rehabilitation, where therapy plans are tailored to the individual needs, helping boost motivation and ensuring long-term progress. Finally, neuroplasticity-based therapies, such as virtual reality training and brain simulation, which activate motivation-related brain areas and enhance cognitive engagement. By integrating these approaches, individuals struggling with apathy can experience meaningful improvements in their recovery. Finding the right support system is essential for individuals with an acquired brain injury or ABI. These are several key resources available. National organizations like the Brain Injury Association of America and the National Institute of Neurological Disorders and Stroke provide education, advocacy, and research-based medical resources. Local rehabilitation centers offer specialized therapy and recovery programs tailored to individual needs. Lastly, support groups and online forums create safe spaces for individuals and caregivers to share experiences, gain coping strategies, and stay connected. These resources play a crucial role in both physical and emotional recovery. In conclusion, addressing apathy after a brain injury requires a multifaceted approach. Motivation is key. Behavioral and medical strategies help sustain progress. Rehabilitation programs that incorporate structured therapy and goal setting improve long-term outcomes. Community support, such as rehabilitation centers and online caregiver resources, provides essential guidance and emotional support. Finally, future advancements in brain stimulation and neuroplasticity-based therapies offer promising new recovering strategies. Ongoing research continues to refine these methods, ensuring better outcomes for individuals on their recovery journey. By combining these elements, we can effectively tackle apathy and support long-term engagement. By understanding and addressing apathy, we can help individuals with ABI regain motivation, rebuild independence, and improve their quality of life. Thank you for your time, and I hope you enjoyed our presentation.